So one of the most common narrative going online right now is sugar feeds cancer. Reducing carbs will reduce the tumor size.
Really has no scientific basis. I don't think you should cut out sugar. Don't take excess sugar.
So what are the hidden dangers behind self-medication or prescriptions?
If the bottle says that it's 1000% of recommended daily allowance, that is probably something that you should not do.
How crucial is gut microbiome and how does it affect with the modern cancer drug?
Having a diet that is rich in fruits, vegetables.
So doctor, if exercise were a drug, how would the prescription look like?
150 minutes in a week is a good amount of aerobic exercise.
How does exercise help in patients undergoing extreme treatments like chemotherapy and radiation?
There will be good days and bad days. The journey of cancer, of going through cancer, that patients and their loved ones go through together. It's probably one of the toughest journeys that a person goes through.
Welcome back to the podcast series by Lilavati Hospital, where we cut through the noise, question the medical trends, and bring you science-backed conversation. Can the food on your plate influence the journey of your cancer care? Can the exercise be a form of medicine? In a world full of medical advices, how do we differentiate the science from the myth? To answer all these questions, today we are joined by Dr. Mohanakrishnan Menon, one of India's leading medical oncologists, with an experience of 2 decades in cancer care across India and US. Dr. Menon brings a unique blend of clinical expertise and practical insight into diet, exercise, and how lifestyle changes influences the cancer care outcomes. Thank you, Dr. Menon, for joining us.
Thank you for having me.
So, doctor, starting with one of the most common questions is that historically the advice for cancer was conservation of energy and rest. But now oncologists strongly advocate for exercise. So what has shifted in the science to make this decision?
Thank you, Dr. Iram. Thank you for having me. You're right. Some time back, the thought process was we need to conserve our energy, especially in this great battle against cancer. So the idea was take rest as much as possible. And that is really what we used to tell people, patients. But there have been a series of these epidemiological studies backed by very solid biochemical and molecular evidence that suggests that exercise is good for you. Many studies have shown that survivals and outcomes are so much better when we treat people or when we tell people to exercise. Not only does it improve your sense of well-being, it also improves outcomes at molecular and other levels, such as improving your immunity, improving the resistance and tolerance to chemotherapy, and generally helping patients in an overall setting.
So, doctor, movement is not just now about fitness, but it has become a form of treatment now.
Absolutely, absolutely.
So, how does exercise help in patients undergoing extreme treatments like chemotherapy and radiation? And how does it differ for patients going through remission?
So, the goal of exercise in somebody who is undergoing chemotherapy or any form of treatment for cancer is different from the goals for somebody who is undergoing, who is in remission. When you're on treatment, you're going to have good days and bad days. So on your good days, yes, you try to keep up with some form of exercise. On your bad days, you take rest and try to do some form of exercise. That is, if you can walk, it's good. You can also break up the exercise. 15 minutes of walking 3 times a day is actually 45 minutes. But even 5 minutes of walking has some value if you are going through a tough time. On your good days, you try to keep up with whatever exercise regimen it is that you can do. Now, in patients in remission, the goal of exercise is something different. There, the goal is to maintain your cardiac fitness, to try and keep the cancer in remission as much as possible, to strengthen your bones if you can, And there you do a combination of strength training and aerobic exercise as much as possible.
So, doctor, if exercise were a drug, how would the prescription look like?
Well, if exercise were a drug, if you're able to neatly package exercise into a drug, it would probably be the most prescribed drug. And, we have been trying to do that for centuries, but we haven't really succeeded in doing so. So, this is definitely a situation of no pain equals no gain. So one does have to exercise. Now, as I said earlier, exercise, there are two broad categories. One is the aerobic form of exercise. And generally, what is suggested is about 150 minutes of moderate exercise. If you can do 75 minutes of, strong aerobic exercise, that's different. But 150 minutes in a week is a good amount of aerobic exercise if you can do that. As far as what constitutes aerobic exercise, walking, you can do rapid walking, it's even better. Jogging, light jogging of some sort, swimming, yoga, calisthenics of various sorts. All these things sort of qualify as aerobic exercises. And as far as strength training is concerned, that is lifting weights, therabands, and so on and so forth, those help to strengthen the bones and the muscles and generally help to maintain your endurance as far as the body is concerned. It reduces your risk for developing fractures. And so ideally you should have a combination of both.
So doctor, it is an equal balance of strength training and cardio when we are talking about a prescription for exercise. Following about this is fatigue. It's one of the commonest symptoms when we are talking about cancer care treatment. And when you suggest for a patient to exercise, it becomes very counterintuitive for the patient. And how does patient take this advice? How do you break the wall?
So fatigue in a cancer patient or a fatigue in a cancer patient undergoing treatment is different from fatigue that most of us face, in the sense that it doesn't get better when you sleep. It doesn't get better when you exercise. So it's one of those enduring problems that a person has when they are undergoing treatment. It's also the most common effect or side effect of treatment that people have during this period. So what do you do about fatigue? I think you start with small steps. Like I said, there will be good days and bad days. On your good days, you try to keep up with whatever it is that you can do. Or rather, on your bad days, you do that. On your good days, you keep up with the exercise as much as possible. Fatigue does improve with exercise. So does sleep and many other factors. So it's a multifaceted problem, or it's a problem that has multiple things, which if you put together, it definitely helps as far as fatigue is concerned. And one of the most important things is exercise.
So what we understand is that the solution of fatigue isn't rest anymore. It's the right kind of movement the patient goes through.
Yes.
Now moving on to, one of the most confusing things which are going for the cancer patient is the diet. They are hearing a lot of things on the internet regarding reducing sugar contents, reducing the carb intake, take these supplements available. So one of the most common narrative going online right now is sugar feeds cancer. Reducing carbs will reduce the tumor size. So what is the hard truth as an oncologist you would like to tell our audience?
Thank you for asking that question. One of the most common questions that I get asked by cancer patients and their families, or it's something that people tend to do, is to reduce or cut sugar out from your diet, which really has no scientific basis. There is something called as a Warburg effect, which is that cancer cells do tend to take up glucose probably faster than most of our normal cells. But then your normal cells also do need glucose. So not taking glucose, not taking sugars, not only is going to starve the cancer, it's also going to starve your normal cells, which is something that you really don't want. You want your immune cells, you want all your normal cells to function as well as they can. Otherwise, it's going to be this declining process that is not beneficial to you. So that is the reason why I don't think you should cut out sugar. Don't take excess sugar. But if you want to reach out for that single rasgulla that's lying on your plate, please do go ahead and do it. There's no harm that's going to happen as a result of that.
So the reality is far more nuanced than what the internet is making things.
Absolutely. And yes, don't take excess sugar, because that will lead into obesity, that will lead to, metabolic derangements, cause problems as far as your diabetes and blood pressure issues are concerned. But not taking sugar is not really the solution for diet.
Doctor, with your experience in advanced treatments like immunotherapy, how crucial is gut microbiome and how does it affect with the modern cancer drugs?
So, as you may have heard, immunotherapy is one of the most interesting frontiers in the treatment of cancers. And basically, in a nutshell, what we do in immunotherapy, it has many different facets, but the part that has gained the most attention or captured people's imagination is that it requires the immune system to react against the cancer. And what we have found is that people who have a varied microbiome in their colon are likely to respond better to immunotherapy drugs than people who have a very limited spectrum of bacteria in their microbiome. So having a diet that is rich in fruits, vegetables, and not using too many processed foods as much as possible is definitely helpful in sort of improving your gut microbiome and thereby improving the likelihood of you doing well with treatment with these immunotherapy drugs.
It's fascinating to know that what happens in gut can influence the treatment plan as well. The cancer patients have been often bombarded with various advices to take various supplements, high dose of vitamins, or even take herbal medicines. So what are the hidden dangers behind self-medication or prescriptions?
Well, that is an industry by itself, which doesn't necessarily have strong scientific evidence. Now, we do know that we need certain vitamins, we need certain trace elements for our body to function. But taking excess of that does not really help. There is good evidence that taking an excess of some of these micronutrients can certainly be harmful to your body. When you look at the bottle of the vitamins that you may see, if you see, there is something called as RDA, recommended daily allowance. If the bottle says that it's 1000% of recommended daily allowance, that is probably something that you should not take. At the most, you should have somewhere in the range of 100% of your recommended daily allowance. And if that is the case, then perhaps that is something that you could do. These things have been studied in detail. That means, you need so much of vitamin A, vitamin D, and so on and so forth, either in your diet or in your food supplement. Something that is more than that is more likely than not to harm you than do you good.
Doctor, definitely this information will raise the awareness among our audience regarding the supplements and the vitamins they take and how it influences the cancer care journey. One last message, Doctor, you would like to leave our audience with in respect to diet, exercise, and how does it influence the cancer care journey?
The journey of cancer, of going through cancer treatment, is something that patients and their loved ones go through together. It's probably one of the toughest journeys that a person goes through and has multiple facets. Diet and exercise are certainly important parts of it. And holding together during this period of time is not easy. As far as diet is concerned, I would say that try to keep up with whatever healthy foods you can. Sometimes having small portions frequently, every 2 hours to 3 hours, is certainly helpful in maintaining that nutrition. It is hard to eat a full thali when your appetite isn't too good. So have frequent small portions of healthy foods. That is something that you can do as far as the diet part of it is concerned. As far as exercise is concerned, it's like that saying, every great journey starts with the first step. So starting the exercise today, rather than just procrastinating and waiting for your strength to improve, is probably where I would start. So just start walking and, slowly, little by little, you'll graduate to something stronger and better. So that's how I would proceed.
Thank you, Doctor, for joining us today and sharing such an insightful information on a topic that is often associated with fear, confusion, and misinformation, which is always available on the internet. Today, we have learned the lesson that cancer care journey is not always about chasing miracle cures. It's about consistency, science-based evidence, and developing habits which sustain and help in the bodily health. Thank you so much again for joining.
Thank you for having me.
And to everyone listening, maybe the goal is not to fear every spoon of sugar you take or run a marathon altogether tomorrow. It is about making smart choices and in the scenarios of panic. Thank you everyone for joining in. And if this conversation helped you understand that how diet, exercise influence the cancer care journey, we have done our job. Thank you and see you in the next episode.